Tonight, Maine is trying new strategies as it battles a surge of COVID-19 cases. And those changes are the result of the quick-spreading Omicron variant. At last check, the variant accounted for more than 98% of all COVID cases tested in the state.
But there are signs of hope. Tonight, 344 people are in the hospital with the virus. That's high compared to other phases of the pandemic, but it's falling. It dropped 16% in just 1 week. It follows the Omicron trend seen in South Africa and the United Kingdom, a rapid rise followed by a quick decline. Welcome to News Center Maine at 5:30, everyone. I'm Zach Blanchard.
And I'm Chris Costa. Thanks for joining us. Today, public health leaders in Maine updated us on the changes to the pandemic response. These are the 3 things you need to know. 1, the Maine CDC will soon end its contact tracing program for the general public. Director Dr. Nirav Shah said this change is not related to the backlog of positive tests. In fact, the 2 processes are parallel but separate. Contact tracing is meant to identify who is sick and try to prevent them or anyone they've been in close contact with from spreading the virus. He says Omicron is infecting so many people at such a fast pace that contact tracing is usually too far behind before someone has already infected another person.
Is that contact tracing is a race. It's a race between public health and the virus. Who's going to reach people first, us or the virus? The virus that we all first knew about in 2020 has changed. It now has a jetpack on its back. It can be halfway around the track before public health even gets its shoes on.
Dr. Shah said people who are not boosted should still quarantine for at least 5 days after testing positive for the virus. Number 2, a glimmer of hope for parents of young kids. Pfizer is working with the U.S. FDA to get a COVID-19 vaccine for kids as young as 6 months old. The federal health agency is reviewing the data. Public health leaders say that age group could become eligible as soon as March. Generally speaking, kids do not have as severe symptoms from COVID as adults do, but we've also seen more kids in Maine catching the virus now than ever before in the pandemic. Since November, each month has produced more cases in kids under the age of 5 than the month prior. January isn't even over yet, and we have more cases in Maine in kids in that age group than in all of December. Dr. James Jarvis from Northern Light Health says kids can still end up with long-haul COVID symptoms, including trouble focusing or concentrating.
Others may be vaccinated in a child's life, but that still doesn't mean the child won't be infected. The safest route to take is to get a child vaccinated.
At their prime age of them learning and developing their skill sets, we do not want them to have any detriment to their cognitive ability and ability to learn in an appropriate fashion.
Jarvis also says being sick prevents a child from learning in person at school. Third, Northern Light Health is providing a new option for people who catch COVID to get treatment outside of the hospital. Patients can now do self-referrals on Northern Light's website. If you test positive on an at-home test and have mild to moderate symptoms, you can sign up for an appointment. Northern Light Health is following state guidance on how to prioritize these treatments, meaning they will consider a person's age, vaccination status, immune status, and risk factors. The hospital system is working with the state to be one of the centers that can distribute oral antiviral pills as well as monoclonal antibodies. But the only monoclonal antibody that treats Omicron is in short supply nationwide.
The fact that we should be getting enough medication in order to take care of anybody who is eligible and desires to be treated. As a healthcare provider, it is my first and foremost job to see to it that we provide the adequate healthcare for those who seek it.
Our public health leaders say the state does have a steady supply of remdesivir, which is used for patients in the hospital. Dr. Jarvis warns that people using sotrovimab as a treatment after infection is not a substitute for getting a COVID vaccination. And those are the 3 things you need to know from today's pandemic updates.